you. So my name is Sara, and as I said, I'm an immunology student, and I'll be presenting my work on my literature review, was looking at if we can treat inflammatory bowel disease, or IBD, with antidepressants and psychedelics. So the overall aim was to understand the role that the gut-brain axis plays in this disease, and to better understand the disease itself. So IBD, as you might have heard of Crohn's disease or ulcerative colitis, and these are the two main subtypes of the disease. It is an inflammatory autoimmune disease, so this is where the immune system attacks its own tissue, and this leads to a really inflamed and painful gut, as well as diarrhea, bloody stool, and an altered microbiome. And that's just in reference to the microbes that live within your gut. And this disease is very prevalent, affecting approximately 6.8 million people globally, usually between the ages of 18 to 35. Unfortunately, there is currently no cure, and this mainly comes down to the fact that we still need to know a lot more about the disease. We don't quite know what causes it, and the current drugs that we do have are anti-inflammatory drugs, and these have worked really well in targeting different aspects of the immune response, and they've done really well at keeping people out of hospitals for the most part and reducing their symptoms. However, the caveat is that they suppress your immune system, and this leaves you more susceptible to diseases and developing different cancers. So this is why I wanted to look at the gut-brain axis and understand the disease outside of the gut, what else is going on. And I'm sure most of you have experienced a time where you've been really stressed and then as a result of this had a stomachache. And this is essentially the basis for where I started my research. And what we've actually seen in the literature is that people with inflammatory bowel disease are actually more likely to develop neuroinflammatory diseases like Alzheimer's and Parkinson's, as well as affective disorders like depression and anxiety. And what's also been shown in the literature is that people who experience early life trauma are also more likely later down the line to develop gut issues like IBD, but also other autoimmune diseases. So this is showing that this pathway between the gut and the brain goes two ways, and there might be a little bit more to the disease than just its inflammation within the gut. And what we're also seeing from mouse models is that when they subject mice to early life trauma, they do this by separating them from the mothers. It's very sad. But what we see is that they did develop gut issues and as well neuroinflammation. And when they blocked the vagus nerve, which is the nerve that goes from your gut to your brainstem, these issues were starting to resolve themselves. So it's a very physical groundwork for this axis. So in the context of IBD, I wanted to understand the role that the immune cells play in this axis and which signaling molecules might be involved to connect the two. And that's where I came to serotonin. You've probably heard of it as the happy hormone, but it does in fact do so much more than that. And the reason why I wanted to look at it is because 95% of your body's serotonin is produced in the gut. And in IBD, where your gut is massively inflamed and dysregulated, I thought that serotonin might also be. As well as this, just to illustrate how many roles it has around the body, that we've probably not even uncovered all of them, but 99% of your serotonin circulates in your bloodstream. Your immune cells also have receptors, which means that they respond to serotonin. So there's a lot of interplay, a lot of going on. And what the research was, what the literature was showing was that people with IBD do have elevated levels of serotonin in the gut and the bloodstream in comparison to healthy people, which shows that there's some dysregulation going on. What was also being shown is that in mouse models, elevated levels of serotonin was also relating with an altered microbiome, and your microbiome also links with regulating your immune response. So a bit complicated, but it seems to be all intertwined, so that was really interesting to see. And thankfully, since serotonin is quite a well-known signaling molecule, we do currently have drugs that target serotonin. And these are psychotropic drugs, which by definition are drugs that alter your mood and perception. And these are antidepressants and psychedelic compounds. And antidepressants, there are many types. For the purpose of this, I'll be referring to the ones that target serotonin. But what was seen in the literature is that patients who have IBD, who are developing depression, possibly because living with a disease caused them to develop depression, or possibly because the inflamed bowel and everything that was going on related with the depressive symptoms, which came first or how it works, we don't really know. But what we were seeing is that the antidepressant treatment was actually improving their IBD symptoms. So there was a very clear direction here between the two. And with psychedelic compounds, the main studies that they're used in is psychiatric studies. So that's looking at how they might treat major depressive disorder or treatment-resistant depression, or just people with terminal illnesses to improve their quality of life towards the end. But what we were seeing is that they were really, really potent, and just one dose can have an effect for up to 6 months, and they were massively improving people's moods. So then I wanted to understand how they worked, what's going on. We know it's improving mood, and that's why they're currently being looked at. But if your serotonin is being produced in the gut and is traveling around the bloodstream and has interactions with your microbiome, what else is going on? The answer is the research is slightly lacking, and we're seeing correlations and different things, but it's a little bit contradictory, and there's not a clear picture just yet, but it would be really interesting to see where the research is going in this area. And another aspect with psychedelic compounds is their way of acting by mystical effects. So the mystical effects questionnaire is 30 questions that's divided into a few different groups, such as ineffability, time warping, but one of them is mystical effects. And across all the studies that I read, every single time, the greater the mystical effects of the experience, the greater the outcomes in terms of positive mood and lowered inflammation. So that was really interesting to see, just another way of looking at patient perceptions and experiences of the drugs, which we don't usually see when we're looking at how effective drugs are. Another aspect was the capacity to induce neuroplasticity. So that's the rewriting and the reorganizing of the neural networks. And if we think back to earlier when I said that early life trauma you're more likely to develop gastrointestinal diseases. And so if we think about maybe we can work top way up and maybe we can rewrite these networks. Nothing solid yet, but it's just correlations and it's potential, but it's just really interesting to see these links. And again, with immune signaling, if your immune cells can recept serotonin, then altering it might have an effect on them. So what this means for inflammatory bowel disease is that these drugs could have the potential to lower your overall systemic inflammation as well as neuroinflammation, possibly have interactions to reduce the altered microbiome and alter perception, so this multifactorial approach. And just another aspect on this psychedelic studies, this was just one that really stood out to me, is that they asked participants to draw pictures of their experience afterwards and describe them in words. And so the words that you see, that is universe, beautiful, these are the most common words that were associated with really strong experiences. So I thought that was nice to share. But overall, I hope that I have explained how complex this disease is and how many facets there are to it. And, you know, it's a disease that affects the gut, but maybe there's more going on. And possibly serotonin might be a target where we can look at all these aspects together. And so I just wanted to leave on the question on if we think that IBD is still a disease of inflamed bowels, or if this is maybe a disease of dysregulated gut-brain axis signaling. Thank you. Any questions?